Hi friends, I am Annie, your friendly health coach. Welcome back to my platform. Today I want us to have a little talk about pneumonia and how to prevent it. You can follow me on all social media platforms if this is your first time on my platform. So let's get started. Pneumonia is a lung infection and can cause wheezing, coughing, or hugging. When you have pneumonia, you may think it's just cold or flu. The signs and symptoms of pneumonia vary from mild to severe, depending on factors such as the type of germ causing the infection, as well as your age and general health. Mild signs and symptoms often resemble those of a cold or flu, but last longer. When you cough, you may produce greenish, yellow, or even bloody phlegm. You may have a fever, you'll be sweating, and have chills. You will suffer from shortness of breath, you have rapid shallow breathing, you will lose your appetite and have little energy. You will also experience nausea and vomiting, especially in young children. People 65 years and older may feel confused or experience changes in their mental consciousness. Pneumonia is usually caused by a bacteria or viral infection that you can catch from someone who is sick, or sometimes by another infection such as flu or coronavirus, or by a fungal infection, or if something gets into your lungs such as water or food, or what we call aspiration pneumonia. Do you know the risk factors for pneumonia? Don't worry, I will tell you. Pneumonia can strike anyone at any age, but the two age groups at highest risk for both infection and more severe cases are children under 2 years and adults over 65. Another risk factor is people who are hospitalized. Since your immune system is already weakened, your risk of getting pneumonia is higher, especially if you are hospitalized in the ICU. Your risk is even higher if you are connected to a ventilator to help you breathe. Another factor is that your risk of developing pneumonia is higher than that of the general population if you have a chronic disease such as COPD, asthma, heart disease, bronchiectasis, cystic fibrosis, diabetes, celiac disease, or sickle cell anemia. The next factor is that you have a higher risk of pneumonia if you have a suppressed immune system such as HIV or AIDS, or you have had an organ or bone marrow transplant, or you are receiving chemotherapy or long-term steroids, or have an autoimmune disease. Another factor is if you have difficulty swallowing due to a condition such as Parkinson's disease or a stroke, you are more likely to aspirate food, drink, or vomit and develop aspiration pneumonia. If you are sedated, prone to generalized seizures, or have received anesthesia, these episodes of reduced consciousness may contribute to aspiration pneumonia. Another factor is if you are unable to cough properly or even enough, this can lead to pneumonia. Your lifestyle increases the likelihood of getting pneumonia. Example, if you smoke, your risk of getting pneumonia is higher than the general population because smoking impairs your immune system's ability to fight off the organisms that make you sick. If you drink too much alcohol or use drugs, this is another risk factor for pneumonia, as you can aspirate food, drink, or vomit into your lungs while under the influence of alcohol. Did you also know that poor oral hygiene can contribute to pneumonia, especially if you wear dentures? If you are in the environment of animals, you may also be exposed to infected excrement that ends up in the swallow. It's important to know that your risk of pneumonia increases with any additional risk factor to your health or lifestyle. If you are wondering if pneumonia can be prevented, the answer is yes. Many cases can be prevented. You can reduce your risk of getting pneumonia by following a few simple tips I am going to give you. Number 1, get vaccinated. Seasonal flu, RSV, and the virus that causes COVID-19 are common causes of pneumonia. If you take advantage of the recommended vaccinations such as the annual flu shot, you can prevent pneumonia. Number 2, wash your hands before eating, after using the toilet, after touching someone, before visiting people who are susceptible to pneumonia, and when returning from public places. Please remember to wash your hands. Number 3, keep your immune system strong by getting plenty of exercise, getting enough sleep, and eating a healthy diet. Number 4, please don't smoke, because smoking makes your lungs more susceptible to infection and compromises your body's immune system. Number 5, if you suffer from diseases such as obesity, diabetes, asthma, COPD, or heart disease, your risk of pneumonia, hospitalization, or even death increases significantly. Try to prevent these diseases through a combination of vaccinations, a healthy diet, a regular exercise, and routine visit to your healthcare provider. Number 6, if you have trouble swallowing, eat smaller meals and sleep with your head elevated in bed. This will prevent food, drink, or saliva from getting into your lungs. Number 7, if you are scheduled for surgery, your doctor may recommend that you stop eating 8 hours before surgery and stop drinking fluids 2 hours before surgery. This can prevent food or drink from entering into your airways while you are sedated. And finally, this is very important, please listen carefully. Treat your cold well so that it does not develop into pneumonia. If you already have a cold, talk to your doctor about proactive measures you can take to prevent pneumonia. If you have a cold, make sure you get enough rest while you are recovering from a cold or another illness. Also, drink plenty of fluid to clear congestion, and don't forget to take supplements such as vitamin C and zinc to boost your immune system. It is no secret that the choices we make can have an impact on our health, so please take good care of yourself. I hope you will put into practice all the tips I have given you to prevent pneumonia. If you have any health concerns, please consult your doctor. If you have any questions or comments, please feel free to leave them below. Thank you, and hey, bye.